Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
The question that came in, and I don't know, you may have already answered it, but Christina B wants to know is, will the answer that you're giving to mama for depression, does that also work for anxiety? And you said that you included anxiety. So is that sort of a carte blanche?
Yeah, so in terms of medication, the medication for anxiety and depression is the same thing. It's exactly we use antidepressants for anxiety. So they're the exact same medication. But in terms of behavioral techniques, there are other things you can do behaviorally for anxiety. Obviously, when our environment is a little bit more rewarding, we tend to have less anxiety. But anxiety is a little bit different. It has more to do with apprehension. It has to do with, fear, whereas depression has to do more with hopelessness. And so fear there are antecedent modifications, I guess, that you could put in place that would assist the individual with their fear. And those are things like, repetition, practice, getting the individual, we always talk about our kids have a hard time with transitions, right? So as you know, Shannon, there are lots and lots of ways that we help our children transition from one situation to another. Why do we do that? Because we don't want them to have anxiety. We don't want to flood them with something that is fearful to them or overwhelming to them. And so with anxiety, it's a lot about that. It's a lot about, again, you can go through the child's in particular kind of daily schedule, and see and identify, if you can, identify the situations that cause fear in the child, that cause sort of, I will not succeed at this, and practice those situations ahead of time. This is why a lot of times parents will ask me, well, why shouldn't I put my child in school? It'll help him with social skills. And I tell them it will help them if they've already learned all the skills necessary, so that when they're put in that situation, it doesn't become an anxiety provoking and failing type of situation. So with anxiety, I think a lot of it has to do with rehearsal, practice, just being able to identify that you will be good enough at this activity. And then there are also kind of exercises that we do when our kids are going through anxiety, when they're just beginning to, we help them identify their own physical responses to anxiety, like heartbeats, or I'm starting to feel my own heartbeat, I'm starting to get nervous. And then we teach them exercises to help control that, like breathing and counting, like going to a peaceful place and playing music, like doing some other activity that is, much more comforting. So there's just a little bit of different techniques to deal with anxiety.
Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.